Yeah. Yeah.
Welcome everyone to the Google chat for this morning. We're going to be talking about emotional eating. This is sponsored by Western Bariatric. My name is Dr. Stephen Reyes. I've been working in the field of bariatric psychology for going on 10 years. I've been doing it for quite a while. I'm pretty passionate about what I do, teaching and preaching health for a living. It's a pretty good gig as far as I'm concerned, and this is a topic that's pretty relevant to most of us as far as that goes. And a lot of the venues that I speak at, this topic is usually a topic of conversation very often. So we're looking forward to your questions. Feel free to participate. Let us know what's on your mind. Any questions you guys have specifically, we'll be happy to address, and we're going to help you in any way we can this morning. So I appreciate your participation. And so let's talk about emotional eating to get going here, exactly what it is and why we do it. Most of us have done it, partake in it, participate in it regularly. Emotional eating takes on different forms. Today we're probably going to be talking more about obviously the problematic habit of emotional eating and why people use that to cope with feelings, for distress, or any emotion of distress as far as that goes. That's probably what we're going to focus on. But if you think about it as it pertains to emotional eating, why do we use food? If you think about our culture, you know, we've all grown up and been raised in a culture where from early on in our development, we've been trained to soothe and reward ourselves with food. So in essence, it's kind of part of our DNA. We've kind of been brought up in that culture, that society. So as far as our history with it, it goes way back for most of us. If you think about, you know, a crying infant, you know, what do we do with a crying infant? You know, we stick something in their mouth. You know, we have a fussy, 7-month-old in a high chair. What do? We put Oreos or goldfish crackers on their tray to keep them occupied. And if you think about every stage of development, in some way, shape, or form, food has been used to either soothe or reward ourselves. I think back in my generation in elementary school, if I did well on a particular test, you know, my first or second grade teacher would reward me with a sucker or candy in that way. My little league team wins the game. Where do they take us? They take us out for pizza or reward us with ice cream or soda. And obviously it was never, you know, our culture or our parents' intent to set us up for developing problematic eating, but we need to recognize that that was a potential effect of doing so. And as I said, you know, we've all participated in these things, you know, as far as that goes. So, like I said, our roots, you know, are pretty deep as far as this emotional eating topic goes, you know. But, you know, now what we're going to address this morning, we're going to focus on weight loss surgery patients and what they need to do after surgery to help with this issue should they struggle with it in that way. So emotional eating, basically, you know, what is it? Probably one of the best, simplest definitions you can think about is basically, you know, using food, you know, a physiological substance to cope with an emotional problem, you know, in that way. And of all the people that I've worked with over the years, you know, every single one will testify that, you know, no matter what was going on with them, no amount of M&Ms, no amount of tortillas or, you know, ice cream, whatever their comfort food was, can satisfy, you know, can fill that void for them in that way. So in essence, it's, you know, all for naught, you know, and I think most people have, you know, participating in that would verify that and would agree with me, you know, on that issue. We're going to talk about, we have a list of questions here. This has come up like a couple times as far as why can't I stop in regards to emotional eating? Why can't I stop doing it? And in my private practice, one of the things I like to assess for is not only the patterns of their behavior and what context they emotionally eat, but what's really, really important for everyone is to identify what their triggers are. You know, what sets you off where you all of a sudden you want to cope with food. You know, is the situation with your boss at work? Is it family stress? Is it, you know, something with your spouse, your kids, or whatever? But it's important to recognize your triggers around you in that way, because more than likely we can't get rid of these people. So we need to figure out how to deal with this in a way that works for us, not against us. So identifying your triggers is number one, is really, really important. Because if you think about it, what we really need to ask ourselves, okay, what is the underlying need I'm trying to meet by the emotional eating? And more than likely, it has nothing to do with food. It's some other issue, it's some other void, some other need we're trying to meet. And we really want to identify what that is. Historically, I've had people come into my private practice for emotional eating problems, compulsive eating problems. And in the evaluation assessment of their situation, I'll just kind of stumble across some kind of relational conflict that they have going on with them. And it's always been interesting to me how once we start to address that issue, once the patient develops some coping skills, whether it's boundary setting skills to deal with this relational conflict or whatever the matter would be, but it's amazing how once they do this, they kind of nullify the need to cope with anything, let alone food. So it's a pretty powerful thing, like when you are able to identify the issue, the trigger in that way, and work on it. That being said, there's all kinds of recommendations out there that people make as far as like coping with emotional eating. A lot of what I usually see as far as lists on the internet and what other clinicians throughout the country recommend, they all tend to be things that take place after the fact, meaning, okay, we're stressed, now we're wanting to emotionally eat, how do we handle that situation? And a lot of these tools, if you will, strategies, are what I call distraction tools, in that way where we can distract ourselves so we don't cope with food in that way. I'm a big believer in being proactive and being preemptive in our behaviors. And if you think about it, any of us, this is a good example, think about it. Anytime you've gone 3, 4, 5 hours without eating, stress comes along, how intense is that emotion, right? And you want to get rid of it, in that way. And if you think about it, whenever we go 3, 4, 5 hours, whatever the case may be, without eating, we put ourselves in a position of compromise. That being said, one of the best proactive things we can do, you guys, is what I like to call staying ahead of the hunger. We want to make sure, we don't go long periods without eating. We definitely do not skip meals. And as it pertains to bariatric weight loss surgery patients, you want to eat according to clock or time, not according to hunger. So what that looks like is basically you wake up at 7 a.m., at 8 o'clock, within that first hour, you're already giving your body, substance, meaning, something with protein content, obviously, being a weight loss surgery patient, because that's super important for you guys. And you know that, and I'm sure you get sick of us telling you how important it is, but it's that important. And it never changes. I don't care if you're a year out from surgery or 10 years out from surgery, the principle still remains the same. It's that important. You still have that need from a physiological standpoint to give your body the substance, And so, depending on what bariatric program you're affiliated with, it's usually 80 to 100 grams a day as far as that goes, and ideally you're giving your body this protein like throughout the day. So that being said, you practice that, you do that, you'll never put yourself in a position where you've gone 3 or 4 hours without putting anything in your body. And what that's going to help you with is be able to deal with frustration a lot better. Because, again, whenever we go long periods without eating, we put ourselves in that position of compromise. And some of us will get that like hypoglycemic effect where we can get a little dizzy or, see spots or not, not feel like ourselves. And so, what we're trying to do is avoid being in that position in that way. Being proactive by feeding your body throughout the day is going to help you be able to deal with things a lot better. You think about, your blood glucose levels. When you eat in that way too, you don't have the spikes, you don't have the lows, and you kind of function in this, stable area. And you owe that to yourself to do it. So that's one tool that's really, really important, really imperative that you can do right from the get-go. Like I said, that never changes. So I don't care if you're a year out from surgery or 10 years out from surgery, that principle remains the same. You don't skip meals, you don't go long periods without eating. And I'm a big advocate. We have some questions?
Yes.
Okay.
Okay.
We have some specific questions, you guys.
David wants to know that everyone talks about having cheat days. Mm-hmm. Wouldn't that just be reinforcing the idea that you are rewarding yourself for being good the rest of the week?
Yeah, I've never been a big believer in that concept because the whole cheat phenomenon, um, it does. It sets us up for failure. But what it tells us from the outset, you guys, like if um, we still value a certain food more than quality of life, or more than quality of life aspects in that way. And what I really enforce with patients I work with too, we want to give less power to food in our lives, not more. And so David had a great question there, and I agree with him. I think it continues to give food power over who we are in that way, because our reward should be quality of life. That should be more important to us than the taste of chocolate, tortillas, ice cream, whatever our thing is. And I'm not saying it's easy to get there, to make that transition, but from the moment you have surgery, and I always talk about how important the first year after surgery is for patients, you want to think about it like you're rewriting your history, meaning you're rewriting your history with diets, with food, the way you think about yourself, all these important aspects of your life. And so if we keep that old history alive and fresh, we're never going to change. We're never going to move on from it. There's a saying that says, if nothing changes, nothing changes. We need to change ourselves. We need to take control of that. So, yeah, that whole reward concept, yeah, I've never been a big believer on that. And the whole cheating concept, I don't believe in cheat days in that way. Because, if we change what we value, we're never deprived, if you think about it. Okay? And the only thing you want to deprive yourself of is illness, right? The only thing you want to indulge in is quality of life. That's where we want to get to. So, another question, Kim?
Yes, Lamika would like to know how, she said, how do I stop snacking even if it's protein?
How much is she snacking? That's an interesting question. Okay, say it again. How
do I stop snacking even if it's protein?
Okay. Well, that may not be all bad, and I wonder how far out she is from her surgery. Because a lot of times the surgeon will tell you guys, to only eat 3 meals, per day, and eat your protein and all that. But there comes a point where, whether you're 6 months out, 7 months out, or beyond, where you get hungry mid-morning, you get hungry mid-afternoon, and that may not be a bad thing. That may be an indication that you're doing something right. Meaning, you're training your metabolism is burning more than what it should as far as that goes, and so the hunger thing may actually be good in that sense. That being the case, I call it intentional snacking. Plan your snack times in that way. I call it the 10 and 2 principle. When we were learning how to drive, they told us to put our hands on the steering wheel at 10 and 2, 10 a.m., 2 p.m. Perfect snack times, mid-morning, mid-afternoon. It's a good visual, good way to remember it. But the content of your snacking, like this person wrote in, is it has to have protein content. Because we know, again, when we give our body the substance throughout the day, we're less likely, or we're more likely to avoid hunger, and our body never senses that it's missing anything. Now, as far as why she's snacking on protein, that's a good thing. I'm not sure if she's snacking with other things in addition to her protein that's causing her not to stop in that way. But theory would hold that there's only going to be so much that you can consume, and you're going to feel satiated, you're going to feel full, and you're going to feel satisfied. So I wish I knew more information on that question.
And then Christina would like to know, isn't it more expensive to eat healthy?
No. We've had some real good research come out recently in the last year or two here, and I think that's a common belief that we share in our culture, that it's more expensive to eat healthy. And this day and age, one of the reports that I recently read identified that only 5% of our population lacks access to fruits and vegetables. Less than 5%. Over 2/3 of our country is obese in that way. So what that tells us is not, access isn't an issue as far as that goes. It's our choices in that way. Another study I referenced, they talk about as far as what we purchase at the grocery store. What we tend to do, we tend to buy more of the non-nutritional foods in that way. We buy more than what we need. We overconsume on those things. And if we were to tail back on that and buy more of the, the fresh fruits and vegetables, sources for protein, it's a wash. It's actually, it comes out, pretty much the same as far as that goes. It really does. In this day and age, too, anyone that belongs to any of the clubs, I mean, you can buy a chicken breast for under $2 a pound. I mean, you talk about, not only a good source of protein or whatever, but, inexpensive, so it definitely can work, towards our benefit. It's just a matter of that perception. I'll confess this, I've been making, my own lunches for almost a decade now, and before I leave the house, start my work day, what's, in my little Tupperware carton, it cost me, I figured this out, it cost me $1.23 for lunch, and I have 30 grams of protein in it, and all that, so that's pretty cheap. If you can, eat elsewhere, for less than that with the same amount of quality, go for it. But I think you'd be surprised how eating good or healthy in that way doesn't have to be expensive. Okay, how much more time we got? Do it? Okay. Great, you guys. So, all right, so what I want to tell you guys now is just a few tools that you can think about that you can start implementing like in your life to help you with the emotional eating phenomenon. There's, like I said, a lot of people out there, on the internet, a lot of clinicians will talk about, some, reactive things that we can do, which is good to know about those things, and it's good to have those in your arsenal, to defeat this stuff. One of which is, you have a craving, you're depressed or lonely, you want to go to food, you phone a friend, text a friend, and that's fine to have that. That's good. As far as like, being anxious, going through that emotion, in that way, do something physical. In that way, that gives you a sense of doing, which is usually what we're trying to, the need we're trying to get met, when we're feeling anxious and we want to eat, which is good. If you're just like exhausted from your day, there's things that you can do. Exercise is always good, but start like a new routine, a non-food routine. Like if you can, make yourself like a playlist of just music to chill out to. Turn the lights down. Light a lavender candle. Definitely not a food scent candle. Don't do the cinnamon buns or the vanilla bean, whatever. In that way, find something non-food related that is soothing in that way. And now that I mentioned that too, I kind of want to talk about, the proactive things that, we want to be able to do. Like I said earlier, we want to try and rewrite our history. And most of our rituals, most of our food routines, you guys, are just that. They're rituals. These are things that we practice because we're all creatures of habit. And, there's so many associations with food that we have in our environment. For example, if every night at 8 o'clock I sit in front of my computer, I check my Facebook, and I eat potato chips over here, and I've done this, for the last year, okay, the next night I go up to the computer, I turn it on, I turn on my Facebook, I don't have the chips. Do you think I'm going to want it? Want the chips? Yeah, it'll probably be there. We train ourselves. It's called classical conditioning. Pavlov was the guy responsible for that, or discovering that, if you will, and we all partake in that a lot. So one of the things I work with patients is to establish new rituals and new routines. And I've done everything throughout the years from helping people kind of re-engineering, their household setup. Like I remember one patient in particular, she sat in this particular chair in the evening after the kids went out to bed, and she had her ice cream, she'd have a certain bowl or whatever. And so she actually, literally, she rearranged her living room just to break up that routine. She started sitting in a different chair so she wouldn't practice what she used to, or keep her old history active in that way. But let me run through some of these, you guys, because I know we're closing in on our time here. But yeah, as much as you can, change your old routines that are associated with food, create new ones. As much as you can, consistent exercise. That's going to help you with anxiety, stress, depression, all that. You owe that to yourself. You owe it to your body to do it. It's so important. And there's, as far as like cravings themselves, like in the moment, this is important to do and important to practice too, you guys. If you can delay it 3, 4, 5 minutes, that increases your chances of delaying it for good. So create healthy distractions. If you're in the kitchen and a craving hits, walk upstairs, to your bedroom, just to distract yourself. Open the top drawer of your dresser, whatever. anything just to get yourself out of that line of thought. Because studies show that if we can do that for 3, 4, 5 minutes, we can delay that gratification. And keep this in mind too, you guys. Every time you're able to do that, document it, write it out, just kind of bullet point in a journal that you can access. Because we want to remember that we were able to do that. Because the more you're able to practice that, the better you're going to get at it. And that's what we want long term. That's what's going to help you, with the whole craving thing as far as that goes. And this is a pretty complex topic. I was kidding with Kim earlier that we could probably do a series on this, and maybe we'll talk about this stuff some more down the road because it's pretty complex. But any questions you guys have, even after we're off the air, feel free to post it on Facebook, and we'll do our best to address it. And we thank you for your participation. Have a great day, guys.